Hello everyone to the history taking course. So this course is designed for students who want to improve their history taking, who want to take the USMLE Step 2 CS exam or any physical exam course. So there are several ways of taking history. Some people just follow mnemonics, some people just follow their medical knowledge. So for me, I like to combine both. So there are certain things that you can use a mnemonic for, and certain things you gotta have a medical knowledge. You gotta have your differentials in the back of your brain and just ask about these differentials. And you have to know like one to two specific questions for each diagnosis. And this way you'll be invincible. So okay, let's start with the lower abdominal pain. How do we approach this case? So a patient present with the lower abdominal pain. This is what we do. We get our paper, we split it in 4 sections. The first section we write like O P D F L I Q R A, O P D F LICRA, plus minus, like this. O for onset. How did it start? Did it start sudden or gradual? Okay. P progression. Forget about self. Think this. P progression. How is it? Is it getting better or is it getting worse? Okay. D for duration. How long you've been having this abdominal pain? F frequency. How often do you have it? Is it constant? Is it every single day constant, or does it come and go? This is very important. L for the location of the pain. Where is it? Is it upper right upper quadrant? Is it the lower left lower quadrant or right lower quadrant? There's a differentials based on the locations. Intensity. How bad is the pain? Is it 10 out of 10? This could be something serious. Could be peritonitis or something dangerous going on, or it could be just light. Oh, just 2 out of 10. Quality of pain. How would you describe the pain for me? Okay, this is important. Radiation too. Radiation, does it move anywhere, or does it radiate anywhere else? Okay, this is important because if it radiates to the back, this could be pancreatitis. Okay, it's like that. If it's radiate to the groin, this could be renal stone. Okay. Association, you can ask because associated with anything, any medication, any physical activity, or anything. The patient knows a lot about themselves. And then we ask about plus minus, like alleviating factor. Anything made it better, anything made it worse. Okay, because usually patients do something to help with the pain or whatever problem they have. And then we go to the past medical history. Past medical history, there's a mnemonic. It's my favorite. I like it. It's called PAM hits FOSS. P for past medical history. Have you been diagnosed with any medical condition at all? A for allergies. Are you allergic to anything? M for medications. Are you taking any medications right now? H for hospitalization in the past. How have you been hospitalized? Okay. And then if yes, then we go ask further questions about that topic. Ill contacts. Have you had any ill contacts? Okay. Trauma. Have you had any trauma or car accident? Okay. It could be they had surgery, now adhesion, something with the bowel. Okay. This applies to anything, not just lower abdominal pain. So this I'm gonna go in details in this video, and the next videos I'm not gonna mention those again. I'm just gonna focus on the differential diagnosis because I believe that's the harder part. But these mnemonics are the easier part. Okay. As for surgery, have you had any surgery in the past? Okay, this is important. Family history. Okay, this is important too. That any of your family member has any medical condition. Okay. O for OBGYN. There's a mnemonic for female, LMP, RTV, CSPAB, which mean L for last menstrual period. Okay. M for menstruation, like is it regular, irregular? Okay. P, oh sorry, LMP is the last menstrual period. R for regular or irregular. T if you're using any tampons. Are using any tampons. B, if there's any vaginal discharge. Okay, this is important. C, for cramps. Do you have any cramps with their menstrual cycle? C, for spotting. Do you have any spotting between periods? PAP for pap smear. Okay, so LMP and PAP, they're just by themselves. But RTV, CS are the one that have words that mean something else. So let's repeat it. LMP, last menstrual period. You ask about that. R for regular or irregular. T for tampons. V for vaginal discharge. C for cramps. C for spotting. PAP for pap smear. Have you had pap smear? When was your last pap smear? Okay, because this is important because it's every 3 years. So sexual history. Okay, are you currently sexually active? Okay, how many sexual partners have you had in the past 2 years or so? Use condoms or not? Okay, it's like that. S, smoking or recreational drugs. Social, that's what I call it. Okay, you smoke, use any recreational drugs. Recreational drugs, this is how, it's a better way to ask it, not any illicit drugs or something like that. And then alcohol. Do you drink alcohol? And if they say yes, you cage them. C, for have you ever thought of cutting down on alcohol? A, have you been annoyed by people comments on your drinking? A, annoyed. G, for guilty. Have you ever felt guilty about your drinking habit? E, have you used alcohol as an eye opener in the morning? Okay. Okay. Pam hits fossa. This is a little bit changes than the one that I used, but this is the same concept. W's work. How's your work? Okay. After that, then you go to the differential diagnosis. Okay. Okay, and then review of systems. You can do it if you get lost. Okay, so this is just to have a review of system. You don't ask, like, I use it. It's just like a dictionary, just to see if I forget anything, I have it. Like sometimes when you are stressed in the exam or under a lot of pressure, you get this mnemonic just to save you if you get stressed. But otherwise, it's good to follow your medical knowledge too. So I'm just gonna go through them, but you don't have to use them all the time, okay? So mnemonics called then for CS Pepsode. Then for CS Pepsode. T is for travel. Have you traveled recently? H for headache. E for eye, any eye pain, any visual changes, any edema too, okay? Eye and edema. Then N for nausea and vomiting. Do you feel noxious? Any vomiting at all? Is this associated with appendicitis, PID? F for fever. Have you had any fever? R, racing heart or rash. Okay. C for chest pain and cough. S for shortness of breath. Okay. Now the Pepsode. P for pain anywhere else. Do you have any pain anywhere else than the one that you're having right now? U, urinary problem. Do you have any trouble with urination? Okay. B for bowel movement. How's your bowel movement? Do you have any constipation? Any diarrhea? S for sleep. How's your sleeping? Okay. A for appetite. How's your appetite? W is for weight. How's your weight? Did you lose weight? Did you gain weight? Or weakness, numbness, tingling. Okay, WNT, that's what I call that. Okay. E for exercise. Do you do exercise? Okay. D for dizziness. So the way I use this review of system just in the back of my brain, I don't necessarily have to ask about every single one of them, but just to have it, if I get lost, I can just go back to them. Otherwise, I'll just use a differential diagnosis. You will see in the next videos, I will go to each chief complaint and dissect it. What are the differentials for each chief complaint? And based on the differentials, I have 2 or 3 questions for each differential that is so specific that would lead me to that differentials. Okay, so this is what I'm doing in this course. So now we put the differential, boom, 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 boom. This I recommend doing it like the first, like, so the moment you go, like if you're in an exam or whatever, you see the chief complaint, you put the blood pressure, heart rate, respiratory rate, temperature, chief complaint, patient name, boom, you get that. And then you split the paper in 4 quadrants. You write your mnemonic real quick. Okay, or PDF, LICRA, PAM hits fossa. Then for CS Pepso, just write the mnemonic quickly. You gotta know it like your name. And then you write the differentials, very important, okay, for each chief complaint. You gotta have a medical knowledge. A lot of people go to the exam without medical knowledge, and then they end up failing the exam. So medical knowledge is important. You gotta know your differentials. You are a physician, okay? You're taking care of patients, okay? So now for lower abdominal pain, okay? So what we think like there could be two things going on in the lower abdominal pain. So what are the things that we concerned about? Gastrointestinal, this could be gastrointestinal origin, and could be urogenital type, okay? Now the gastrointestinal pain. So for gastrointestinal system, we ask these questions. So we ask, do you feel noxious? After we ask this question, so do you feel noxious? Okay, we asked about it. It's in the review of system too, but these are questions that are very important. Any change in your bowel habits, okay, this is important. And then if they say yes, there's a changes in bowel habit, we ask, have you eaten outside? This could be travel or diarrhea, okay? Do you have any fever? Okay, have you ever been exposed to anybody with similar infection? So this, I'm asking about traveler diarrhea, okay, something that happened when you travel. And then we ask, any blood in the stool? This is important question too. Okay, if there's any blood in the stool, if they say yes, then I'll ask about the amount, color, and clots. Is it before, after, or mixed with the stool? This is important too. And the odor, was it smelly? Okay, was there any smell with your stool? And then we ask about diet. Okay, did you change your diet? Sometimes like if there's lactose intolerance or some allergic to a specific type of nutrient. Any relationship of pain with bowel movement? Okay, this is important. Any pain during sleep? Okay, this is for inflammatory bowel syndrome. Okay, pain with bowel movement and pain during sleep too. Incomplete evacuation, these are the questions for inflammatory bowel syndrome too. Joint pain, oral ulcers, okay, so this is for inflammatory bowel disease too. Any vomiting, this is with nausea and vomiting, we ask about it, okay. So this is the gastrointestinal side, okay. Now we'll be talking about the genitourinary side, okay. So we ask, this is for females, we ask about the last menstrual period, menarche, when was your first menstrual cycle, any pain during intercourse or defecation, this could be endometriosis, any irregular cycles, how many tampons, pads do you use? This we're already gonna ask about it, but just to repeat it. Any cramping during your menses, this is with endometriosis too. Any vaginal discharge, this is for pelvic inflammatory disease. Any spotting between your period, this could be a polyp, uterine polyp, could be leiomyoma, could be adenomyosis, or whatever uterine pathology. Are you pregnant? You ask them this one. Or then abortions, have you had any abortions in the past? And when was your last pap smear? Okay, so these are the types of questions that we ask about, okay. And the differentials is based on if it's right upper quadrant, if it's left upper quadrant, right lower quadrant, left lower quadrant. We ask about it, we'll discuss it in next videos in details, but this is in a general, they're just present with the lower abdominal pain. It's something just to guide your thinking. After that we do physical exam, head, ear, eye, nose, throat exam, and then we do gastrointestinal exam. We do rebound tenderness for peritonitis, that's important thing, and then we do cardiovascular exam. Listen for the heart and lung quickly. And then we order labs. Labs we can do because you're not gonna do it at the exam, so you order a rectal and pelvic exam because these are not the one that you're not gonna do in the exam. You just order it like you on the software. Rectal and pelvic exam. You do beta HCG, CBC, CMP. You do stool for occult blood like FOBT. Okay, so this is AST/ALT bilirubin with the CMP comes. Ultrasound of the abdomen and CT scan of the abdomen too. Upper GI endoscopy, colonoscopy, and laparoscopy. You can put them, but you're not gonna order all of them. Okay, but just those just to keep in the back of your brain. This to order like based on the differentials that you're gonna have. Okay, so this is the summarize whatever we talked about. So when someone present with anything, you split the chart, you do O, PDF, LICRA plus minus, and then PAM hits fossa, and then per CS pepsode. Okay, you ask about each one of them, and then you go. It could be GI complaints, or it could be genitourinary complaints. Then we ask questions about each one of them. Okay. So thank you so much for listening, and I hope you have a wonderful day.